So this is story of Mr. Bhaduri who is sitting there. Mr. Bhaduri had again a bypass surgery done maybe 25-30 years back. It was in Noida, and he has so many students, all Muites, and they are all dangerous guys. They will call you 10 times in a day. What happened to my teacher? He was such a popular principal there, and he happened to had heart dysfunction, kidney failure, and one fine morning, we thought that nothing could be done to him. He was already admitted twice or thrice in our hospital, but there was only one thing, there was silver lining. His ECG had a broader QRS, left bundle branch block. And there is a guideline which says, if you feel that, if you assess that patient's survival is not, expected survival is not 1 year, it is lesser than 1 year, you can't put a device. Then came the dilemma. Guidelines don't say to go for a device, and here is a gentleman who has a wide QRS, only silver lining, where if I can fuse the QRS to a narrow QRS, things can turn around. But guidelines they don't say. But there was a breather. It is for CRT, it is not for lot CRT, it is not for conduction system with a CRT. So that is not falling in that guideline. I did a video counseling to his family. I think madam is sitting here, his daughter. I told the chances is only 20% of his coming out. This is just crossing the line. I am going against the guidelines, but this is the bright light which I see at the end of the tunnel, and you can take the choice. And then started coming, the calls, so many calls. Someone had, and you see, Muites are really doing well. Everywhere they are, at the top. So I got many calls, and then I took him and got him, out again. I can't do that, because if I fail, my reputation will be just, it will be haywire. So the day I took him to cath lab, his heart rate was 120. He was barely able to speak. So I had just asked him to, sir, I will not do the do procedure on him, and I just told him to, and family members, I can't do. Then there was a push from his students. No, you carry on. Next day, we are there. We have accepted what has happened to happen. What will happen? We have accepted. So I took him. Please carry on. Carry on. Carry on. Next. Issue this ECG. This looks like a normal electrocardiogram. This is what I got with a fusion of lot CRT. And then happened the story. Everything turned around. His kidney became normal, his heart now pumping at 50-55%, and now he is coming and telling you, your daughter, when is she going to Mayo College? But this is my personal opinion, don't send her to Mayo College. So I had taken, he has given me, his advices also. So he will be coming, he will be sharing some of the, his words to all of you. So it's surprising and miraculous, that's all I can tell.